staying strong, healthy, and youthful. By subscribing, liking, and ringing, you can greatly support our channel and help us produce more content that you'll love. Hello and welcome to the Longevity Lifestyle YouTube channel. In this video, we'll be talking about transient ischemic attack. Transient ischemic attack is a neurological condition that involves a temporary interruption of blood flow to the brain, leading to stroke-like symptoms that usually disappear within 24 hours. However, despite being temporary, transient ischemic attack is a serious condition that requires immediate medical attention because it can be a warning sign of an impending stroke. What causes transient ischemic attack? The most common cause of transient ischemic attack is an embolus or clot that blocks a blood vessel in the brain. The clot may be formed in the brain or may travel from another part of the body, such as the heart or carotid arteries in the neck. Other less common causes of transient ischemic attack include atherosclerosis, hardening of the arteries, arterial dissection, tear in the lining of an artery, and vasculitis, inflammation of the blood vessels. What are the symptoms of transient ischemic attack? The symptoms of transient ischemic attack are similar to those of a stroke but are temporary and usually last only a few minutes to a few hours. The most common symptoms include sudden weakness or numbness on one side of the body, including the face, arm, and leg. Difficulty speaking or understanding speech. Sudden vision loss in one or both eyes. Sudden dizziness or loss of balance. Severe headache. What are the risk factors of transient ischemic attack? There are several risk factors that can increase the likelihood of experiencing a transient ischemic attack. Age. Transient ischemic attacks are more common in people over the age of 55. High blood pressure. High blood pressure is a leading cause of transient ischemic attack and stroke. Diabetes. Diabetes can damage blood vessels and increase the risk of transient ischemic attack and stroke. Smoking. Smoking damages blood vessels and increases the risk of transient ischemic attack and stroke. High cholesterol. High levels of cholesterol can lead to the buildup of plaque in the arteries, increasing the risk of transient ischemic attack and stroke. Heart disease. Heart disease can increase the risk of blood clots, which can cause transient ischemic attack and stroke. How is transient ischemic attack diagnosed? If you experience any of the above symptoms, it is important to seek medical attention immediately. Your doctor will perform a physical exam and may order several tests to diagnose transient ischemic attack, including neurological exam to test your vision, hearing, strength, and coordination. CT scan or MRI to check for signs of damage to the brain. Carotid ultrasound to check for blockages in the carotid arteries. Echocardiogram to check for problems with the heart's valves or chambers. Blood tests to check for clotting disorders or other medical conditions. How is transient ischemic attack treated? Treatment for transient ischemic attack depends on the underlying cause and the severity of the symptoms. The main goal of treatment is to prevent a stroke from occurring. Depending on the cause, your doctor may recommend blood-thinning medication such as aspirin, clopidogrel, or warfarin to prevent blood clots. Lifestyle changes such as quitting smoking, eating a healthy diet, and exercising regularly. Surgery to remove blockages in the carotid arteries or repair aneurysms or arteriovenous malformations, AVMs, in the brain. Medications to control high blood pressure, high cholesterol, or diabetes. What is the prognosis for transient ischemic attack? The prognosis for transient ischemic attack is generally good if the underlying cause is identified and treated promptly. However, transient ischemic attack is a warning sign that you are at risk for a stroke, and the risk of stroke after a transient ischemic attack is 10 to 15% within 3 months. Therefore, it is important to follow your doctor's recommendations for treatment and lifestyle changes to reduce your risk of a future stroke. Conclusion. Transient ischemic attack is a serious condition that requires immediate medical attention. If you experience any of the symptoms of transient ischemic attack, seek medical help right away. By understanding the causes, symptoms, diagnosis, and treatment of transient ischemic attack, you can take steps to reduce your risk of a stroke and improve your overall health. Thank you for watching, and we hope this video has been informative and helpful. Don't forget to like and subscribe to our channel for more videos on health and wellness. See you in the next one.